ಇವತ್ತು ನನ್ನ ಜೊತೆ ಡಾಕ್ಟರ್ ತೆಹಸೀನ್ ಸರ್ ಇದ್ದಾರೆ. ವೆಲ್ಕಮ್ ಟು ಅವರ್ Media Connect channel, sir. Sir is a fibroid embolization expert. So he's all the way from Kerala or Bangalore bandidare because he has operated more than 3,000 plus cases in Kerala and most of the cases were from Bangalore. So Bangalore alli demand ಜಾಸ್ತಿ ಇರೋದ್ರಿಂದ ಈ ಸಲ ಅವರೇ ಬ್ಯಾಂಗ್ಳೂರಲ್ಲಿ ಒಂದು ಯೂನಿಟ್ ಓಪನ್ ಮಾಡಿದ್ದಾರೆ. ಸೊ ಅವ್ರ ಬಗ್ಗೆ ನಾವು ಕೇಳ್ಕೊಳ್ಳೋಣ ಬನ್ನಿ. Sir, can you just brief about yourself?
I'm Dr. Tehseen Advanjari. I'm a consultant cardiologist at Astra Hospital in Kerala. And we are specialized in procedures called embolizations, and there are so many procedures for embolizations. So many organs can be treated by this embolization.
Okay, welcome to Bangalore, sir. Sir, now the audience want to know what are uterine fibroids actually. So most of the middle-aged women are suffering from uterine fibroids. The survey has shown that 25% of middle-aged women suffer from uterine fibroids. So can you just tell us what are the symptoms, the initial symptoms what they suffer from?
The fibroids usually, they are not non-cancerous tumors of the uterus. It causes excess bleeding during menstruation.
Okay.
Excess pain during menstruation. And sometimes if it is big, it can compress on the bladder in front, and it can cause recurrent urinary infection or urinary retention. And if it is compressing backwards, it can cause constipation. And some of the patients will come with a very big tummy because of huge fibroids.
Okay. So these are the main symptoms. So viewers, ಎಲ್ಲರಿಗೂ ಕನ್ನಡದಲ್ಲಿ ಹೇಳಬೇಕಂದ್ರೆ ಸರ್ ಹೇಳಿದ್ರು ಮೇನ್ಲಿ ಮೆನ್ಸ್ಟ್ರಲ್ ಸೈಕಲ್ ಮಂತ್ಲಿ ಪೀರಿಯಡ್ಸ್ ಏನಿರುತ್ತೆ ಅವಾಗ ಬ್ಲೀಡಿಂಗ್ ಜಾಸ್ತಿ ಇರುತ್ತೆ ಆ್ಯಂಡ್ ರಿಪೀಟೆಡ್ ಯೂರಿನರಿ ಇನ್ಫೆಕ್ಷನ್ ಆಗ್ತಾ ಇರುತ್ತೆ. ಇದಕ್ಕೂ ಜಾಸ್ತಿ ಆದರೆ ಕಾನ್ಸ್ಟಿಪೇಷನ್ ಇರುತ್ತೆ. ಸೊ ಇಲ್ಲಾಂದರೆ ನಿಮಗೆ ಲೋವರ್ ಅಬ್ಡಮನಲ್ಲಿ ಸ್ವಲ್ಪ ಬಲ್ಜಿನೆಸ್ ಕಾಣಿಸ್ತಾ ಇರುತ್ತೆ. ಸೊ ಇದೆಲ್ಲ ಬೇಸಿಕ್ ಸಿಮ್ಟಮ್ಸು. ನಿಮಗೆ 1 or 2 monthsಗಿಂತ ಹೆಚ್ಚಿಗೆ ಈ ಥರ ಸಿಮ್ಟಮ್ಸ್ ಕಾಣಿಸ್ತಿದ್ರೆ ಖಂಡಿತ ಬಂದು ಸ್ಕ್ಯಾನ್ ಮಾಡಿಸ್ಕೊಂಡು ಸರ್ ಹತ್ರ ಕನ್ಸಲ್ಟ್ ಮಾಡ್ಬೋದು. So usually for fibroids there are authentic type of operating things and all that. Now you said you have something very minimal invasive treatment which is very upgraded version. So can you just brief about UFE treatment for us?
If the patient is symptomatic like the previous case, the options we have are surgeries like removing the entire uterus or removing the fibroid alone.
Okay.
Instead of that we have this procedure called fibroid embolization.
Okay.
The fibroid embolization, what we are doing is we are putting a small tube through the wrist.
Okay.
Under local anesthesia.
Okay.
A patient will be awake, and we are passing this tube into the uterus.
Okay.
Into the blood vessels of the uterus.
Okay.
And inside the blood vessels, we are giving some injections, and the blood vessels will block the blood vessels which is giving blood to the fibroid blocks.
Okay.
The fibroid will not get any blood. Without blood, the fibroid will start shrinking, and the patient will get the relief.
Okay.
And the procedure will take only 15 minutes.
Oh, is it? Oh, lovely. ಸೊ ಕೇಳಿಸ್ಕೊಂಡ್ರಲ್ವಾ ಎಷ್ಟು ಮಿನಿಮಲ್ ಇನ್ವೆಸಿವ್ ಪ್ರೊಸೀಜರ್ ಅಂತ. ಯೂಶಲಿ ಫೈಬ್ರಾಯ್ಡ್ ಅಂದರೆ ಮುಂಚೆ ಪ್ರಾಪರ್ ಮೇಜರ್ OTನಲ್ಲಿ ಆಪ್ರೇಷನ್ ಥಿಯೇಟರಲ್ಲಿ ನೀವು ಮೇಜರ್ ಆಪ್ರೇಷನ್ ಥರ ಕಟ್ ಕೊಟ್ಬಿಟ್ಟು ಎಲ್ಲ ಮಾಡ್ತಿದ್ರು. ಇವಾಗ ಅಡ್ವಾನ್ಸ್ಡ್ ಆಗಿದೆ ಟೆಕ್ನಾಲಜಿ. ಸೊ ಸರ್ ಹೇಳ್ತಿದ್ದಾರೆ ಜಸ್ಟ್ ಇನ್ವೇಸಿವ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಅಂದರೆ ಜಸ್ಟ್ ಒಂದು ಟ್ಯೂಬ್ ಹಾಕ್ಬಿಟ್ಟು ಸೊ ಯೂಟ್ರನ್ ತನಕ ಆ ಟ್ಯೂಬ್ ಪಾಸ್ ಆಗುತ್ತೆ ಅಲ್ಲಿ ಯೂಟ್ರಸ್ ತನಕ. ಸೊ ಅಲ್ಲಿ ಕಂಪ್ಲೀಟ್ ಬ್ಲಡ್ ವೆಸಲ್ಸ್ನ ಬ್ಲಾಕ್ ಮಾಡ್ತಾರೆ, ಫೈಬ್ರಾಯ್ಡ್ಗೆ ಎಲ್ಲಿ ಬ್ಲಡ್ ಸಪ್ಲೈ ಆಗ್ತಿರುತ್ತೆ ಅಲ್ಲಿ. ಸೊ ಅದನ್ನು ಬ್ಲಾಕ್ ಮಾಡಿ ದೆನ್ ದೇ ವಿಲ್ ಡೆಸ್ಟ್ರಾಯ್ ದಟ್ ಟ್ಯೂಮರ್ ಅಂತ ಸರ್ ಹೇಳ್ತಿದ್ದಾರೆ. ಇಟ್ ಟೇಕ್ಸ್ ಹಾರ್ಡ್ಲಿ 15 minutes ಅಂತ. ಇಟ್ಸ್ ಸಚ್ ಅ ವೆರಿ ಗ್ರೇಟ್ ನ್ಯೂಸ್ ಸರ್ ಆ್ಯಕ್ಚುಲಿ. ಆ್ಯಂಡ್ ವೇರ್ ಡಿಡ್ ಯು do the course, sir, the IFE course?
I got trained from Paris and Valencia in Spain.
Okay.
And I'm still attending courses and getting my techniques better.
Correct, the experience, yes. Now you said it is just a 15 minutes procedure, the UFE procedure. Now the thing is it painful for the women?
The procedure is actually very simple.
Okay.
The patients will not feel any pain because we are giving a local anesthesia.
Okay.
But immediately after the procedure, once the fibroid starts shrinking, they'll have abdominal pain.
Okay.
So to cover that abdominal pain, we'll admit the patient for 1 day.
Okay.
And we'll give medicines.
Okay.
The next day, within 12 hours, that pain will disappear.
Okay.
And then patient can walk home.
Okay. And how about the women who has hypertension or diabetes? Can
Not
they
a
also
problem
undergo?
at all, because even patients taking antiplatelets, that is blood thinning medicines, we can do the procedure without stopping the medicines because we don't have anesthesia. We are just giving a local anesthesia, so not a problem at all.
So now, sir, after you get them scanned, no? So if they have multiple fibroids, can this be treated with UFE?
The blood supply to that uterus and fibroids are the simple one. And if you block this blood supply, entire fibroid
complete.
will be damaged by the procedure. So we can do in a single procedure.
You can
we
do
can
that.
finish all the fibroids.
Okay. Sir, now what is the difference between the old style conventional type of treatment, the surgical treatment, and the new advanced UFE treatment? What are the main differences?
The one thing is this is not a surgery. This is a simple procedure. Takes only 15 minutes. And after the procedure, patients can walk out of the room. We don't have structures and nothing.
What is the
nothing.
recovery time, sir, after the procedure?
Immediate.
Oh.
There is nothing. It's immediate.
Okay.
They are going to their room. There
Uh-huh.
is no ICU.
Okay.
They are with their family.
With the the ward.
In surgery, we need to have ICU.
Correct.
Anesthesia, recovery, all those things. Nothing is there. This is they are getting out of the room, walking out, and the entire hospital stays only 24 hours.
Okay.
In surgery, it will be more.
As you said, they might get abdomen pain.
Yeah.
Okay.
So we are keeping them for 24 hours inside the hospital. So today morning we are doing the procedure. Next day morning we can go.
Okay.
Okay. So there are so many advantages. One is there is no anesthesia and no ICU stay. Only single stay, 1 day in hospital. The patients can immediately start doing every work.
Okay.
There is no sutures, no
Okay.
scars,
Okay.
nothing. So what happens is that many of these patients will be housewives. They have to take care of their husband, their kids, their parents. Sometimes they'll be working also. Okay.
Correct.
So at this time they cannot take rest for 1 month or 2 weeks or 3 weeks. Not possible for them. So this is an ideal procedure which helps them to relieve their symptoms, and this is 10 times safer than surgery also, because there is
Okay.
no anesthesia and cutting and all those things.
Okay.
It is 10
No
times
side
safer.
effects, no adverse effects.
Extremely
for this?
rare. Extremely rare.
Okay.
So such a wonderful procedure it is.
Okay.
And we have done around 3,000 cases till now.
Oh, wow, great. Okay. ಸೊ ನೋಡಿದ್ರಲ್ಲ ಎಲ್ಲರೂ, ಡಾಕ್ಟರ್ ಥರ್ಸೀನ್ ಸರ್ ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡಿದ್ರು UFE ಅಂತ ಒಂದು ಪ್ರೊಸೀಜರ್, ಅಡ್ವಾನ್ಸ್ಡ್ ಪ್ರೊಸೀಜರ್ ಯುಟಿರನ್ ಫೈಬ್ರಾಯ್ಡ್ಸ್ಗೆ ಹೇಗೆ ವರ್ಕ್ ಆಗುತ್ತೆ ಅಂತ. ಇಟ್ ಈಸ್ ವೆರಿ ವೆರಿ ಸಿಂಪಲ್ ಪ್ರೊಸೀಜರ್, ಜಸ್ಟ್ 15 ಮಿನಿಟ್ಸ್ ಪ್ರೊಸೀಜರ್ ಅಷ್ಟೇ, ಆ್ಯಂಡ್ ರಿಕವರಿ ಟೈಮ್ ಕೂಡ ಜಸ್ಟ್ 1 ಡೇನಲ್ಲೇ ರಿಕವರ್ ಆಗ್ಬೋದು ಅಂತ ಸರ್ ಹೇಳಿದ್ದಾರೆ. ಯಾರಾದರೂ ನಿಮ್ಮ ಫ್ಯಾಮಿಲಿಲೇ ಇರ್ಬೋದು, ನೀವೇ ಇರ್ಬೋದು, ಅಥವಾ ನಿಮ್ಮ ಸಿಸ್ಟರ್, ಮದರ್, ಯಾರೇ ಇದ್ರೂ who are in need, you can help them out by sharing this video. So kindly share this video, and anyone who is actually suffering from these kind of symptoms, please consult Dr. Thazeen sir.